We have attained the quorum. Members, we have attained the quorum now. There are so many meetings going on at the same time. So this is the first meeting under the black storm, rainstorm warning. So we invite the administration in, please.
你講其實留喺度好啲，佢冇第二個會應該。如果大家議員冇第二個會嘅咧，盡量。
Unless members have other meetings to attend, please stay.
啲老人家即係阿柱哥可能都要去，你冇份 ，OK。得，唔該，政府嘅官員入嚟，我哋。
The administration is making its way in. There are two papers. I'd like to call upon Mr. Chen, Sidney Chen, to take us through. The first one is the administration's response to issues raised. The DOJ concerning the number of convicted cases involving charges of obtaining access to a computer with criminal and dishonest intent. This paper CB21521/03 and also paper 1521/02, administration's response to issues raised at previous meetings. Secretary, please. Chairman, at the last meeting, members wrote to the DOJ regarding the breakdown of specific statistics. The DOJ has already replied that they have the year-on-year breakdown, but not the breakdowns by categories, and members were referred to the Security Bureau for the details. I am given to understand that the upcoming panel meeting, the SB will be taking the matter up with members, so it doesn't have any more direct relevance to our discussion here. The other thing is, on May the 18th, members sought supplementary information regarding 3 issues, where I refer members to paper CB21521/02. First of all, when we discussed the Code of Practice, the COP, the legal advisor highlighted the fact that in some ordinances, the Code of Practice will be admissible in legal proceedings, but here in this bill, it is silent on this provision. There were 4 examples that were highlighted by the legal advisor. Here in this paper, under usual evidential rules, the Code of Practice will be admissible in legal proceedings, even though it is not specified in the law. The legal advisor highlighted 4 pieces of legislation that specify this, but in fact, in many other ordinances, there is no such provision. So in paragraph 3, we cited quite a number of examples to show that an absence of this provision doesn't represent anything out of the ordinary. There were also questions regarding the Administrative Appeals Board that will adjudicate some of the decisions. Members asked about the operational details of the AAB, whether there is any performance patch regarding the time taken for handling such appeals. Paras 4 to 9 set out the operation of the AAB. It is set up under the ordinance. This AAB has jurisdiction to determine appeals against decisions made under 73 ordinances. There is a chairman or vice chairman together with the board members who will be sitting in judgment of the cases. When appeals are received at a number of time frames, now when someone lodges an appeal, then within 14 days the AAB will serve a copy of the notice on the respondent, and the respondent will have 28 days to make representations, and thereafter the appellant can make further representations. Now, with all these procedures completed, the board will decide when the appeal will take place, and normally the parties concerned will be served a notice no less than 28 days before the date of the hearing. In paragraph 9, we have given the statistics in 2014. Now, in 2014, a total of 63 appeals were received and 50 appeals were handled. As I said earlier on, when an appeal has been received, there are specific time frames, although it doesn't say how soon the hearing has to take place upon receipt of an appeal. Now, that's because the number of factors at play, like the details of a specific case, the total number of cases that come forth, and also there may be a need to reschedule a hearing date. So there is no specific time frame regarding the hearing that takes place. C, there were members who raised a question about protection of public officers. Clause 58 is not unique in this bill. The member asked whether there are any other examples in the ordinances. In fact, this is quite a commonplace in the laws of Hong Kong. We have highlighted a dozen or so pieces of legislation, although this is not an exhaustive list. Now, this is to show members that this is indeed a common practice. Those were the three questions that members sought supplementary information. All right, then. Any questions? Let's deal with them one by one. First of all, the DOJ's reply. Any comments there? If not, I'd like to go on the record to say something here. Sid Ho would like to bring up Section 161(1) under the Crimes Ordinance, vis-a-vis Clause 41(6)(b), and she would like to have some information for comparison that would enable us to understand how Section 161 is enforced. From the DOJ's reply, we are given to understand that they don't have such statistics, and we are referred to the Security Bureau. I'd like to reiterate that over the past 2 years or so, I put similar question to the SB, and I was referred to the DOJ. In fact, DOJ is still dealing with Section 161 question. Quite surprisingly, we are now referred back to the Security Bureau. They may not be prepared to divulge the details. I don't really want to get bogged down on this particular point and get in the way of the scrutiny of the bill. I feel that in this particular bill, 41(6)(b) 1 to 4, Roman 1 to 4, these 4 points there, they may not be the same as Section 161 of the Crimes Ordinance, or they may be similar to Section 161 of the Crimes Ordinance, obtaining access to computer with criminal and dishonest intent. Here, if one commits an offense under the bill that would require knowingly committing the offense, like the access to the health record and damage of the criminal or the health record. So this has been narrowed down by comparison with obtaining access to computer with criminal and dishonest intent. I would be inclined to accept that the scope has been narrowed down. But I'd like to say, however, that under the Crimes Ordinance, A is not there. So there is no presumption there. And it is a different situation. And that's precisely the reason why we'd like to find out more about that particular piece of legislation.
So I want the following point to be recorded. Now, the DOJ is passing the ball once again back to the Security Bureau. I am not happy with this. Despite this, we are scrutinizing this bill right now. DOJ said that there isn't the information. I think this is really impossible. I just believe that they are not willing to provide the information. But now we will continue to scrutinize this bill. We will take note of this view. Okay, that's all from me. Any other comments on this part from members? If not, then let's move on to the next paper. So any comments on the code of practice? No? No comments? Then concerning the information on the administrative appeal board, nothing. Then about protection of the public officers, any comments, questions? No. Legal advisor, you have questions? Chairman? Protection of public officers, this provision or clause. Some time ago during our meeting, we discussed this. If you refer to clause 58, bracket 3, it states clearly that it doesn't only apply to public officers. Now, according to clause 48.3, it also applies to people appointed under this clause. Some time ago, the chairman asked a question about clause 58, bracket 3, whether the people stated there include the outsourced people. At that time, the administration said yes. And after the meeting, I discussed with the administration. If those people have a contract with the commissioner, should the spirit of contract be respected? Instead of using this provision on protection of public officers to offer the protection, can the administration give some elaboration? Mr. Chen, we said last time that apart from protecting public officers, when the HRC is being used, sometimes we need people outside the government to help us do the work. For example, we have to seek help from people working in the hospital authority, or we have to ask external contractors to do some work for us. Now, if the external contractors or hospital authority colleagues, we want to protect them when they discharge their duties in good faith, then we will use clause 58, bracket 3. And 3b states that clause 48.3 is related. That is, the commissioner will hire external people, but then it is not right to say that we will protect all external contractors. In some cases, according to clause 48.3, only those people appointed under this clause will be protected. Legal advisor, I want to ask about your policy intent. Do you want to include people with contractual relationship with the commissioner? Let's say if they discharge their duties in good faith, however, there's negligence on their part. Without this clause, then they can seek civil redress according to the contract. But with this clause, then they will be excluded. In other words, he cannot pursue the external contractor. So I want to know whether this will cover people with contractual relationship with the commissioner. Mr. Chen, I will ask Ms. Lee to explain things to the legal advisor. First of all, if all contractors, external contractors, are to be included, then this should be stated explicitly as in other clauses. However, this clause is written in a narrow way. It has to go through 58(3)(b), and it states, and it includes people appointed under clause 48(3). So we have to work according to clause 48(3). 48(3) talks about helping the commissioner in his work or in exercising his power. So we are not talking about other functions performed by the external contractors. So this wording is rather narrow. Now, when it comes to the EHRC, we have to seek help from people of the hospital authority to write the program and to set up the whole system. Future system maintenance will also be done by them. So we do need a provision. Now, the commissioner has the responsibility to maintain and operate the system, so he may need to go through 48(3) to appoint staff of a hospital authority to do the work. However, we do not intend to cover all external contractors, but we don't rule out the possibility that there may be a small number of people who help the commissioner to discharge certain duties or functions according to the law. So we have to appoint these specific persons according to 48(3) to do the work. But the original intent is not to say that everyone who has contractual relationship with the commissioner will have to be included. If that's the case, we will write that all people with contractual relationship will be covered. Then where to draw the line? So it seems that we will only rely on 48(3). That is to help in performing a function and exercising a power. Okay, yes, under the ordinance, the commissioner does have some responsibility and work to do. 48(1) also states clearly that he has a number of functions to perform, and only he will know which parts of the work won't be done by him or public officers. Then he has to appoint some non-public officers to help discharge these functions. So he has to pinpoint or designate these people very clearly. If you read 48(1)(a), his functions are very wide. Setting up, operating, and developing the system. So in that case, people will think that one contractor may help him write the program and be responsible for technical development. Then in 3B, the appointed persons will be included. So that's why there may be the issue. Should this clause come first or the contract first, as you said just now? Not all external contractors will be exempted according to your original intent. But now it seems that because of this wording, this clause, the contractors will be exempted. Thank you. First of all, the contractors will not be exempted right away just because of this clause. because we haven't stated that the contractors will be exempted. We're talking about people appointed in writing through 48(3), and we want to make a point that for these clauses, under the law, there are a lot of this kind of provisions. For example, under the Privacy Ordinance, there are some similar provisions, so that the Privacy Commissioner can make arrangement for those he employs or engages. And these people can be exempted. So for these provisions, well, they are rather common in other laws. Mr. Lo Wai Kwok, follow up? Yes, I want to express my views. I think we have to read clauses 48 and 58 together. So no matter whether we're talking about the public officers or people appointed under clause 48(3), Chairman, you also mentioned external contractors. I think they have to meet the requirements of 58(1). So in other words, they do not need to bear civil liability for an act done or admitted to be done by the person in good faith and purportedly performing a function or exercising a power under the ordinance. So, under what circumstances will they take part in the work, for example, developing the system? Now, the protection will have to be in accordance with 58(1)(a)(b). I think this is quite clear. Of course, I am not very familiar with the wording of other ordinances, but then I guess when the circumstances are similar, this principle will hold. This is my view, Chairman. Legal advisor, I would like to supplement. Protection of public officers. Well, we may not only be talking about public officers. Now, in some committees, there may be people offering service for a fee. Okay, then 3B refers to people appointed by the commissioner. This is rather special. There may be people with contractual relation with the commissioner. Then without this clause, if there are any problems in the contract, they may make claims according to the contract. But with this clause, then it seems that they won't be able to get civil redress. Now, according to C, some points are set out, but then the exact clauses or provisions are not listed out. So can you let us know which clauses or which provisions in the laws are written in a similar way with 3B? I think this is rather important. We're talking about people with contractual relationship with the government. Well, there may be a contractor who may want to sue following the civil proceedings, and then if there are these circumstances, then they may be able to escape, right? Ms. Lee, you said that there are other similar provisions under the laws. Well, the other provisions may not show exact wording, but the meaning is similar. The legal advisor is worried that there are people who have contractual relationship with the commissioner and they may be exempted because of this clause. This won't happen because if there is only the contract, if the persons are not appointed by the commissioner in writing, then they will not be covered. So in other words, this clause won't include people with contractual relationship. It only includes people appointed by the commissioner in writing to help him perform a function or exercise a power. So in other words, under 48(3), the commissioner will appoint some people in writing. Only those people will be included, not people with contracts. So what will constitute a written appointment under 48(3)? So does he need to sign himself, and does he need to write very clearly on the letter that he is appointing someone according to clause 48(3)? Is that the difference? Yes, the commissioner. Well, we are talking about written appointment, so there must be a document. So the commissioner will have to sign on a letter stating the kind of work that the person will be asked to do. That is not good enough. So in the letter, he has to put down very clearly the kind of power that he is now exercising to appoint him. Yes, he has to do it via 48(3). If you read 58(3)(b), I think the meaning is very clear. So here it says a person appointed by the commissioner under section 48(3). When the commissioner exercises his power to appoint according to 48(3), does he need to put down in the letter in writing that now I am appointing this person according to section 48(3)? Only that will carry that meaning, right? Is that the difference? So in writing, he has to quote 48(3).
Chairman, your understanding is correct. We cited the examples earlier that we're not protecting the contractors, not all of them, with this provision. If we offer this kind of protection, then we will have separate provision or separate clause to say that the contractor is engaged under 48(3) for certain tasks. The legal advisor is concerned about the legal liability if the contractor is not doing the right thing. As we said in bracket 1, we have a precondition. Whether this is the HA staff or the contractor, he has to do the work in good faith. And in subclause 3, he is helping or assisting the commissioner in performing a function or exercising a power. If he is not conducting the work in good faith, then there will be no such protection. As with other contracts, if the contractor has done something that fall foul of what is required of him, then we will pursue the matter with them. Dr. Leung Kai Lau and Dr. Lo Wai Kwok. Chairman, if the government's position is not to protect the contractors, then I hope that you would make it clear. It's no good for you to say what you said, because otherwise people will have to take up the minutes of this meeting to pursue the matter. We should specify in the bill what you meant. The legal advisor already pointed out that from what I read, we cannot pursue the liability. You said that some contracts there is no such protection. Why don't you call it a spade a spade? Mr. Chen, Chairman, it's not the case that we don't want to include the contractors. There may be contractors, there may be HA staff that would like to incorporate here, but it's not the case that every single one will be included in this provision, so it's not all-inclusive. So for the ones that we'd like to include, we can specify that they are so included, otherwise we don't have to do anything. So this is not all inclusive. It's not the case that we want to exclude them. If we want to exclude them, we might as well not have this provision anyway. Dr. Lo Wai Kwok, I am asking a similar question. The definition of the appointees is rather narrow in scope. He has to be appointed by the commissioner in performing a function and exercising a power. Some of the contracts may not be coming under this particular clause. If there is an intention to offer protection, then it will be so specified. Under normal circumstances, a contractor may not be fully aware whether it will be protected. For a commercial contract, can 58(1)(ab) be invoked as a defense? I am as concerned about this as Dr. Leung Ka-Lau. You said that there may not be protection. Then as a contractor, I may be very concerned about it, because we're dealing with privacy issue, and I may be in breach of the law. So if someone is not appointed under 48(3), so how would the contractor know where they stand in terms of legal liability? Secretary. Chairman, thank you. In 48, to develop, operate the system, there is a lot of work to do, and you may have in mind the development of software, the IT, and so on. And there may be security measures that will be contracted out. We're not intending to cover all the contractors under 48(3) in terms of protection. And there may be a team that needs specific protection, and we would invoke 48(3) to specify the kind of tasks that the contractor is engaged to perform. And the contractors would know where they stand. They would have a written notification if they are caught under 48(3), so there will be no confusion as to whether there will be any protection or not. Dr. Low? If I may make myself clearer, Chairman, if there is no written appointment, if it is just an ordinary contractor, there must be a commercial contract. But when it comes to legal liability or civil liability, can someone advance a defense under 58(1)(a) and b? 58(1)(a)(b), other than that, subclause 3 refers to this section, applies to the following. So we have to look at these in conjunction with subclause 3. Dr. Low? So if you fall outside subclause 3AB, then 58(1)(ab) cannot be used as a defense. Is that right? Right, this is the case. I am very concerned about it then. I'm not sure whether this is the normal procedure regarding contracting out services, whether it is the software development or not. Do they have to be held civilly liable? It has to do with the civil liability under the contract. I come across this issue quite a lot, and members don't seem to be noticing it. Or is it a unique situation? I think I have to defer to the DOJ for a reply.
我諗就住呢一個58
On the question of 58.1, it is not so much a defense. Clause 58 is about a kind of safeguard, so that if someone is undertaking the task in good faith, then there will be no civil liability. In terms of contractors, when they fulfill the contracts and undertake the tasks, they have to consider when delivering the service whether there is any negligence, any omission, and so on. So generally speaking, if there is any negligence, the contractors will have to face the civil liability anyway. Dr. Low? It seems to me that it is sufficiently clear. 58.1ab, even if you fall within 58.1ab, you will not be protected unless you meet the requirements under 3. So I think we have to leave it to the court as to whether this can be used as a defense. Is that right? 58 refers to the protection. It is indeed a kind of protection. But this kind of protection, would it be enough of a protection? I don't think I should get bogged down on this point. I'm clear about your reply. For ordinary contractors, they cannot invoke Clause 58. Dr. Leung Kan Lau? Chairman, I think the legal advisor already pointed out that when someone is appointed to a board as a member for advisory purposes, he may not be remunerated. Like Dr. Low Wai Kwok said, for the contractors who are making profits, they would be very concerned. They have to show that the commercial risks, if there is any negligence, now someone may be undertaking the task in good faith, but still there can be negligence, not in bad faith, but in good faith. In many cases, in most cases, I think the negligence will be committed in good faith, and they have to be held civilly liable. It's hard to say. It can be deliberate. So the legal advisor said that we should be showing some examples as to whether there are similar provisions. If there are concerns, I think we have to put it beyond doubt. Either in 48.3 we put it beyond doubt, or we do so under 58.3, and that would remove any doubts in future. Talking about civil liability, as the commissioner, he can pursue matters in a civil manner. We're talking about other people, whether they have a similar right. That the civil damages are not merely the damages under the contract, but also the damages for negligence. We should put it beyond doubt. In Clause 58, it is protection of public officers, etc. Now this etc., I'm not sure whether this is the usual kind of drafting. Like the legal advisor said, this kind of provision is there to protect the public officers or the public or the people providing services at boards and committees, etc., seems to be rather broad. The next question then is, like what I asked the secretary, do we need written appointment? Now the next question is, how will the commissioner decide when to issue a written appointment under 48.3? Now, what criteria would the commissioner decide to give written appointment or not to give written appointment? The law is not sufficiently clear about the criteria that will be adopted in issuing written appointment, and there may be certain cases that the appointment will be in writing, and in other circumstances the appointment will not be in writing. So there is no specification as to when this power will be invoked.
According to usual policies, this will be made narrower. We will be talking about public officers like government officials, government employees, or committee staff members. So if we delete and etc., that kind of things, then we are talking about public officers. When we hire contractors to do some work, usually people won't doubt whether they are public officers. Director? Thank you, Chairman. As explained just now, 58.1, 2, 3 and 48.3 should be read together. We have narrowed the scope of protection. We are not trying to protect all public officers and contractors with Clause 58. First of all, he has to be acting in good faith. And secondly, let's say if that person is not a public officer, he is a contractor, then he has to get the written appointment from the commissioner under 48.3, that the commissioner is appointing him to do certain work. So not everybody will be protected. The purpose of protection is, let's say if a person makes a complaint, he feels that he is being harmed and so on, then the complaint may not be against a public officer, because bracket 2 states that the whole government will have to be responsible. And then the aggrieved person may sue the government. And if in a certain situation the contractor has signed a contract with the government, then usually in the contract there are terms that you have to complete a certain work at a stage. If you can't, then you will be subject to a certain penalty. But then if the work performed is not good, then we'll have to see whether there is the written appointment from the commissioner according to 48.3. And we have to see whether he has breached certain contract terms. Then we can seek redress according to the contract. Then the scope of protection is very small. Do we only want to protect public officers? Now, as explained in Paragraph 11, there are other similar provisions. In some other organizations, even their full-time staff members are not public officers, but still they have to offer protection to their staff. And then in these organizations, the work cannot be done only by their full-time staff, so they have to seek help from external parties. So there are similar provisions in these cases. It is difficult to draw a direct comparison right now, but our colleagues can try to refer to some very similar recent provisions. Yes, please do so. When there are public officers and people working in that organizations and external workers, then perhaps we can allay members' doubts. Okay, please provide the information before the next meeting. We want to be sure that this is not a new policy. About the protection and exemption, well, gradually the scope is being widened. We just want to be certain that this is not a new arrangement started by this bill. No, this is not our new practice. Sometimes the government protects public officers and other people it appoints. In the Privacy Commissioner's office, the colleagues are not civil servants. Now, there is a provision to protect their full-time staff and also people who work for the organization. Ms. Lee, in 11A of the Privacy Ordinance, there is an exemption clause. The Commissioner himself or designated persons, if they work in good faith, then they can be exempted. And the designated persons are, according to 9(1), people being employed or engaged. Then 9(1) is very similar to our construction. So the commissioner can hire people he deems right, or he can also engage, other than by way of employment, people to help him exercise his functions under PDPO and exercise his right, his power. So the privacy ordinance also uses a certain provision to engage people. Even though the wording is not exactly the same, the meaning is close. So protection will be given to people the commissioner employs or other people engaged by the commissioner under 9(1)(b). So this wording is not created by us. Mr. Lo Wai Kwok. I have heard this example, but concerning the scope of protection under PDPO, I think it is wider than the one we're looking at. Now, the one we're looking at is narrower. Apart from public officers, we're talking about people appointed by the commissioner. And just now, in the example, employed or engaged, this is wider. If that's the construction in the PDPO, the contractors may not be as worried because it seems that that one is wider than the one we're looking at. The contractors may not be worried, but then those people who would like to make a complaint or would like to lodge a civil claim may be worried. Right, I understand. But I feel surprised why that one is wider than this one. Yes, that one is wider. So it seems that now we are stuck in the middle, but we don't know whether there is really an established policy, or perhaps we have misunderstood. There isn't an established policy. Usually these provisions will apply to normal public officers. I don't know whether there are new points. Perhaps you don't need to repeat points made. Next time, please give us a paper so that we can have some reference. According to our timetable, next time, well, I guess it is also the hope of members that this bill be passed within this year. So we don't want to dwell too long on this point. Please raise the points if you want any specific amendments. We'll see whether the government will move the amendments or the committee will have to move the amendments. Let's not dwell on one point for so long. Next time, the government will give us the paper, and then we won't have too much time to work on other things. The government has listened to members' views, so perhaps you may consider adding some points or words to allay members' worries. Yes, Chairman. We have only given the name of the ordinances, but we would try to illustrate our points that in many ordinances there is the clause to protect public officers and other people selected by the organization. So contractors and so on, for example, we can identify similar provisions. Can you also give some explanation? For example, in the PDPO, according to what policies will the commissioner offer exemption in some cases but not in other cases? What are his considerations? People may think that this commissioner or the decision maker has wide power in making decision. But people don't know under what circumstances will he exercise his powers. Under the PDPO and Hospital Authority Ordinance and other ordinances, there are provisions to protect full-time workers and contractors selected by them. I cannot speak for them to say what criteria they adopt to select these people, but we are talking about our bill, so I can let you know. I can share with you some examples in my mind. So people we may want to protect with clause 48.3. So we can only concentrate on the scope that we can give an answer on. Okay, if there is no other question or comment, then let's move on to the next point. After completing clause-by-clause examination, then apart from this point, next time the government will give us another paper, then there shouldn't be any outstanding issue. We may have to discuss some CSAs, and on the 20th of May, Mr. Lang Ka Lau sent us a paper with amendments on appointed health care workers and receivers. CB 1521-1415-01. That is the paper given to us. So perhaps Mr. Leung can explain your proposed amendments, and then the government can respond. Mr. Leung, thank you. My letter is straightforward. I've explained my previous concern. Some patients may be seeking medical service from the hospital authority, and they may have queued up for a long time. Then they may get some kind of examination, for example, brain scan outside, computer scan, and so on. Now, he may want the private lab to upload some information, but he may not want to refer to all shared data and information with the HA. That's one point. Then in some other cases, sometimes patients don't want others to know about their illnesses, so they consult private doctors. They want the private doctors to be able to read the medical records kept at the HA, but then they don't want the hospital authority to know that they have consulted private doctors. They may not want the hospital authority to be able to know what private doctors they have consulted in the shared information. So in principle, there will be more protection for the patients, because then the patients will have more control. Now, according to the current construction of the bill, referring to the administration's response, the rationale of this system includes 2 tiers of consent. one is consent for participation, and the other is consent on the sharing of information. So first of all, on the first tier of consent, the hospital authority will be allowed to upload and download information. And then in the second tier, private doctors and healthcare workers can upload and download information. Then in that case, I said just now that many patients hope to protect their privacy. Then this two-tier arrangement cannot satisfy the goal. Now, if you refer to the third paragraph in the administration's response, so the consent to participate in the sharing system. In the actual operation, what do we mean by participating in this sharing system? This is not mentioned. Reading from the bill, this means that the hospital authority and the Department of Health will be allowed to access information and share information. So with these two tiers of consent, is it reasonable? First, the hospital authority and the Department of Health can upload and download information. The second tier is private healthcare providers can also upload and download information. Are these two tiers reasonable in protecting patients' rights? Usually, I think a better arrangement is on the first tier, all healthcare providers, no matter whether they are public or private, can upload information. Of course, the patients can set some restrictions. On the second tier, no matter whether we're talking about public or private healthcare providers, then with the consent, people can read the uploaded information. I think that is more reasonable.
For the technical matters, I leave them to the administration. The administration said that the bill is technology neutral. I'm not from this IT sector. I leave it to the administration regarding the issue of technology, but in terms of the protection of patients' privacy, and this is something for the Bills Committee. I fully appreciate that to amend this, we have to convince the administration to do so. If the administration is not convinced, then we can come to an agreement here for the committee to move the CSA. Otherwise, I can move my own CSA. Mr. Chen, will you respond to Dr. Leung's amendment? Chairman, thank you. On Dr. Leung's amendment, we have a paper explaining the government's position. That's paper 2152, bracket 1. Basically, we are in opposition to Mr. Leung's amendment because this amendment runs counter to the two-way sharing that we are proposing. We have designed the system after 5 years. We had public engagement, we had the steering committee, we have laid down all these principles, and we have spent considerable amount of public funding to come up with this system. And it's not appropriate for us to make major changes here at this stage. If the CSA is approved, we have already developed the system. We have spent the funding on the system. the design of the system is not the same as what Dr. Leung has in mind. If this CSA is approved, then it will render the entire system not operable. It is for these three reasons that we object to the amendment. In papers 3 through to para 10, we have explained the situation, highlighting the three factors that I mentioned. Dr. Leung already explained his objective. His objective is not the same as that of ours. I stand to be corrected, Dr. Leung. Dr. Leung believes that with a better system, if we start from scratch, the consent given to providers should be split up. Now, the provider can access the information and can also download the information. Now, this is not what we have in mind. We don't have a split system. Our policy objective, is to set up a sharing platform for the public and private service providers to get access to the health record of the patients. And there's going to be two-way sharing. They can get access to the information, and they can download the information. They will upload and download the information. Once they've joined the system, there will be two-way sharing arrangement. This, we believe, will be better, will be beneficial to the patients. The pilot system is a one-way system. It is considered to be very beneficial. With this two-way sharing, it would be even more beneficial. The patients can decide whether to be part of the system. If they want to be part of the system, then they can get access to the record of the patients from other providers, and they should also upload their information onto the system. We're not splitting up the system at all. I appreciate what Dr. Leung said. In some cases, some patients may feel that the information from the HA should be made available to the private practitioners, but not the other way around. Or they may want to upload the information only. Dr. Leung cited some examples here. Simply put, he is advocating a one-way sharing system. In our system, this is not possible, and he is suggesting that we revamp the system to achieve what we have in mind. Our explanation is that if we allow the providers, service providers, to engage in one-way sharing, then this is not in keeping with the policy intent, because we like to have a two-way sharing system. If we allow at the very beginning a category of people who engage in one-way sharing, then it would be running counter to our policy intent. So philosophically, we do not support this idea. We appreciate that there may be certain circumstances where the patient might feel that he doesn't want his data to be made available to so many people, or he may want to stop the consultation from being shared. Now, we discussed a number of times the deposit box feature. After a number of discussions, we fully understand that there may be some clauses, or there may be some design features whereby patients can exercise some choices. But as I said last time, we haven't quite achieved that at this particular stage. In the next stage, we will conduct a study and see whether we can develop all these functionality for patients to have more options. Some members expressed the concerns last time that will there be any legal backing in what we do. Now, we have been discussing with the Privacy Commissioner. Although we haven't got the features there yet, we can come up with some legal provisions that restrictions can be imposed in such a way that the sharing will be more narrow in scope. So we have 16A, the new provision. As soon as the new system is in place, we can invoke 16A and 16B. Now, the patients can choose a number of restrictions. Let's say there are 9 shareable data. Can there be one? They can be withheld. That's one way. Or alternatively, the patient might withhold the data for a couple of months or for a certain period of time. Or the patient might want to withhold the data kept in HA or in a certain practitioner from being shared. He can choose to do so, and the information will not be shared. So there can be a whole series of scenarios that will be permitted under 16A and 16B, because 16A doesn't limit the scenarios exhaustively. All these can be covered under 16A and 16B. So depending on the outcome of the study, once 16A and B come into effect, the 2 scenarios mentioned by Dr. Leung, i.e. one-way sharing situation, can be catered for, and there is no need for us to revamp the entire system. So this is intended to let members know that this can be catered for under the law. Also, Dr. Leung's proposal represents a major change to the system. A lot of work that has been done will need to be done again with the CSA. The whole system will be rendered inoperable, and there will be significant implications on the patient. So for these reasons, we are in opposition to the amendment. Dr. Elizabeth Kwok and then Dr. Lo Wai Kwok. Chairman, I understand Dr. Leung's concerns and misgivings. So that's precisely why I would like to bring up 16A and 16B. I think the administration has given me a reply that these 2 clauses can address Dr. Leung's concerns. I think I hope Dr. Leung will accept this arrangement. This EHR, I hope that this can be implemented, and we can certainly make improvement as we go along. Dr. Lo? Chairman. My views are similar to those of Dr. Elizabeth Kwok. 16A, there are certain wordings that would be very broad in terms of restriction. It refers to the scope of shareable data. It may involve uploading and downloading, the scope of doing so, and all the parties concerned. So in terms of wording, they are sufficiently broad. The administration's attitude is very clear now. With this new provision, they will not come into effect on the day the system is activated, and when everything like the access restriction and so on is in place, that this will be implemented. From the wordings themselves, they are sufficiently broad. I'm wondering whether Dr. Leung will find this acceptable, will have his worries assuaged. Maybe we can hear from Dr. Leung in just a moment. However, if we impose too much restriction on sharing, then we will not be able to achieve the desired effect under the bill. I find the head of the EHR acceptable. Dr. Kwok-Kah-Kee, Chairman, we welcome the idea of a safety deposit feature at the second stage. And now we have to endorse this for the first stage. 16A and 16B offer some choices. I don't think this is sufficiently secure because we're not sure what's going to happen in the future.
Can Dr.
Leung Ka-Lau's concerns or points that he would like to see be implemented in the second stage? We don't know. Yes, the government is going to conduct some studies, but at this stage, when the bill is to be passed, the mutuality of this sharing system is allowed. That's my first point. If we're talking about things that are technically not feasible, as mentioned by Dr. Leung Ka-Lau, I don't think this should be an obstacle, because we all understand that technology advances rapidly. In the past, when we input information or commands, we cannot put in too many commands at the same time. But now technology advances very quickly. In the future, if patient opts for sharing of information concerning the uploading and downloading of certain information, if the provision can be wider, then in the future, I think it is helpful to attract more patients and doctors to join the system. In fact, Dr. Leung's point represents many worries. In the future, when patients and doctors join this sharing system, they will see less incentive, and then this will affect the feasibility of the system. And we're talking about public money. A lot of, billions of dollars are put in. So if there is wider choice, then people won't have so much concern. Then I guess participation rate will be better. Now people have so many concerns, and patients can opt for not joining. Of course, I'm sure you want more patients to join. If there are obstacles refraining people from joining, then I think we have reviewed these points before. Dr. K.K. Kwok's question is about the point of things that Dr. Leung Ka-Lau asked for. But then these are not in the system right now, so there's the need for further development. Dr. Kwok says that technology advances very fast. Can you respond to Dr. Kwok's point? If these features are to be added, have you estimated the time requirement? In the last round of consultation, there are not these requirements. But then at this stage, if these new features are added, that's another problem, because that means we're not acting in accordance with the results of the last consultation. Yes, we do have the right to add further requirements, but to a certain extent, this is overriding the result of the next consultation. Okay, any response, please? Thank you, Chairman. Let me first comment on Dr. Kwok's first point, and then Dr. Zhang can elaborate on the second point about the difficulty, the technical difficulties. Dr. Kwok, Dr. Leung, and other members have asked questions about 16A and 16B. Can they take care of Dr. Leung's worries? When we wrote or drafted 16A and 16B, we had examined it many times. We have also discussed with the Privacy Commissioner's office. We are thinking of the wording. We haven't done the second stage study, so we don't know the final outcome. Okay, in the future, patients can put down restrictions to narrow the scope of people who can refer to his records. Now, 16A and 16B are to limit the scope of sharing of the health information. So this will include different types of restrictions. For example, certain information can't be read, or information before a certain year can't be read, or some organizations will have the right to read and upload things into the patient's records. Now, our drafting will limit or reduce the right of organizations uploading and downloading information. So now, I think the room for flexibility is at maximum. In the future, if stakeholders agree, if they do want patients to have the choice, so they can choose to limit the hospital authorities and Department of Health's power in uploading and downloading information. I think, technically speaking, that will be a big issue. We don't think that there will only be problems about the policy on the policy level. I will now defer to Dr. Zhang.
To clarify that it's actually not a technology issue as such. It's not a matter of saying that we can do more because the computers have gotten faster. It's actually, it is. Oh, sorry. It's a design issue. So the system as it's been designed today has been based on the consent model that's in the legislation as is today, and that's taken years of work by hundreds of people to come up with, and the change that's been proposed is quite a fundamental change. So we have to start, I think the chairman mentioned, from the discussion phase to start looking at what this change would mean in terms of the system, how it's designed, what the workflows are, and then, of course, we have to do the development, then the testing, and so forth. And it would take, we're talking about years. It's such a fundamental change. And it sounds simple, but when we do IT systems, a fundamental change requires a possibly major rework. So this would be a major issue. It's not that we don't have the technology to do it. In fact, when we look at the 16A, 16B, whatever we implement out of those, we would have to make changes. Of course we would. But that is what we're saying. We would need to do that in phase 2, and we would have to take the time and the resources to do that. So what this legislation change as proposed would essentially require us to do that phase 2 work now before we can go live, which would mean a multi-year delay and also a resource requirement, which is not there actually at the moment. There's no money to do it. So it's not that the technology is not capable. Technology is certainly capable, but the design work, the discussion work, all that has to be done to make it workable. The other point I'd just like to point out is it's mentioned in the response is that one of the major goals is that this system has to be a simple system, an easy-to-use system. If you look at some of the other international examples where they've made complicated consent models, and I'll give you an example is the Australian model, the PCHR there, those systems fail because they are too complicated. So for us, we need to find a system which attains the privacy needs, and those have been mentioned, is technically doable, and I believe that's not really an issue, but lastly, it has to be simple and understandable by the majority of the users. So that's what we have to do in this next phase of work. It's certainly not been done yet, and if we were to put those clauses in now, more or less we're assuming it's been done, and the system as today does not meet those needs and could not go live.
主席，我跟進少少，即係我就覺得有少少。
Chairman, let me follow up. I find some conflict here. Dr. Zhang said that this is not about technology, but he referred to time, requirement, and design. These are about the techniques or the technology. About Dr. Leung's worries, Mr. Chen said that 16A and B can address the issue, but Dr. Zhang said that changes in 16A and B are really not feasible and unrealistic, considering the complexity of the design that may take many years. So on one hand, the government said that 16A and B can solve the problem, but then next the response is that it is not quite feasible to change 16A and B. I am not agreeing to the amendment, but I find this logically problematic. Okay, you can either not admit that this is a technology problem, but then on one hand you do not admit that this is a technology problem, but on the other hand you said that a lot of time will be required, it is very complicated, it is going to be a negative impact on the users. I think this is incompatible with Dr. Leung's point. Now, I think when you use the system, the design can be much better than what you have in mind. The design will change. 16AB allow a lot of restrictions proposed by the patients themselves. If your system cannot tolerate these requirements proposed by the patients, then 16A and B are not genuine. You are saying that, okay, you can propose many restrictions, but I can't do it. Well, there is an effective date for 16A and B, but that will be in the future. I'm worried that these cannot be done in the future. I'm worried that this won't happen. I think this is a matter of delivery time, not that it is not feasible. Dr. Zhang, can you respond to Dr. Kwok again?
The system as it is today cannot do what 16AB or what Dr. Leung is asking for. We have to do this in what we call phase 2 of the program, which has been discussed before, I believe. So we would have to design the model which would allow the sharing restriction in phase 2, and of course do it in a way which, it's not technically simple, it has to be simple for the users. That's what I'm saying. It has to be understandable by the majority of users. So that would take design effort, and then we'd have to do it. So it's doable, it's certainly doable, but it's just not there at the moment. So I think the point we're making is that if we were to accept the changes as put forward by Dr. Leung, we would have to have the changes in there now, and they're not there. So that's why the system would have to be delayed. So what we're proposing is that 16AB gives us the legislative foundation for making the necessary changes to meet the additional privacy requirements of those people who need those, but we would also have to do the work in the next stage of the program. It's not. No.
So this is not a problem of technology. It is not infeasible. Well, after the commencement of the bill, we still have to wait a few years for the system. This is a substantial difference, according to the government, that the system cannot provide this additional feature right away. Okay. Thank you, Chairman. You said a few years. I'm worried. Do you mind telling us when this system will be available and when 16A and B will come into effect? That's my first point. Secondly, I want the government to clarify, with 16A and B, members of the public can make different choices. Now, the hospital authority will do registration as one organization. In the future, can members of the public choose? For example, he can say that he only wants a certain department responsible for his case to be able to retrieve the information. In the future, if I say that the hospital authority can retrieve my information, can I differentiate who in the hospital authority can have the right? Mr. Chan? Thank you, Chairman. Let me respond. First, concerning the timing. Last time, when we discussed the safe deposit box issue and also the sharing restrictions, we have explained the timetable. In the second stage, we have just completed the first stage. In the first year of the second stage, we will do a study on the design of this sharing system. And we'll see whether stakeholders agree to the result of the studies. If so, then our colleagues can do the technical work. And then 16A and 16B will take effect under the law so that this function can be implemented.
And that is the time frame under the original plan. As to how long it's going to take will depend on the combination of options that will be available. Under 16A, it doesn't specify any particular options. In future, there can be sharing restrictions imposed. So the way it is worded, we leave a lot of flexibility, and the restriction can be on certain information from being made available, or the restriction can be on a particular consultation, or the restriction can be on a clinic or the HA having access to my data. That that is Dr. Leung's point about uploading. This can be done without amending the legislative provision. That's why I said 16A and B will allow us the maximum flexibility. Like Dr. Zhang said, the existing system as it is doesn't cater for this function under 16A and 16B. Whatever restrictions Dr. Leung has in mind, these will not be catered for under the existing system. It's only with further funding and further design that we will be able to do this. And that's what Dr. Zhang was trying to explain, basically. With technology, it is doable, but this is not catered for under the existing system. Will there be a situation in future, the HA or a particular clinic? Now, once the hospital in Central has been given the authorization, there can be access, there can be uploading, or can we make it so narrow that only the medicine discipline can get access, but not the cosmetic discipline? And under 16A, 16B, this can be considered. And this is by way of clarification. Earlier, Dr. Kwok asked a question as to whether we can cater for the combination of scenarios Dr. Leung referred to, and if we cannot achieve that, will the doctors not find this preferable? Like Dr. Zhang said, the Australian system allows a lot of flexibility, but after 1 year of implementation, the system proves to be too complicated, and after a year or so of implementation, very few people registered themselves with the system, and they had to conduct a complete overhaul of the system. So when we have our system, we have to make sure that it is going to be simple and easily understandable. I'm no expert, but like a handset, at the very beginning, the handset would only allow phone calls to be made and to receive. As technology develops, the handset can cover web browsing and GPS and we move along a step at a time, and that would make it easier for the users to take on board this system. At the very beginning, we're doing the same thing. We'd like to have new features added as we go along. So if you make it too complicated, then it would be a different matter altogether. Dr. Quat? I'd like to make some clarification. The HA will be registered. Your system can be designed in such a way that it would be accessible to certain disciplines only, but HA is registered as one single entity. When 16A and 16B are in place, that would be making it very difficult. What their reply is that they're not sure until they have the consultation. If after the consultation they have to do it, then they will come up with a registration system. Is that the case, Mr. Chen? Chairman, with regard to the restrictions, the patient might want to remove a hospital in Central or the HA from gaining access to the information, or the patient might want to have some restriction on the number of people being given access to the record. Let me quote one more example. Let's say an organization has a membership system, and after members have joined as membership, there can be restriction on the time that certain people will be allowed to use the tennis court and so on, instead of kicking out all the members per se. So if members agree, Clause 16A, we can narrow down the scope in such a way that if a patient goes for orthopedic treatment at Central Hospital, then the data will not be uploaded. That this will be allowable. So under the law, this is doable, and technically this is doable. But would HA be able to handle it as an entity? Is it your point? Chairman, under the law, an organization is registered as an entity, a single entity. There may be problems. Yes, under the bill, an organization is registered as an organization, and that and these kind of options will not be allowed. Mr. Chen, no, it's just like a membership. Today we have just one basic membership. In future, there can be different arrangements where certain service will be withheld from this member. Dr. Leung Ka-Lau. First of all, my proposal is not against the two-way sharing principle. When a patient gives the sharing consent, then the public-private HCPs can upload the information. As to who can view the information, then the patient will have to give the sharing consent to the HCP. This is indeed the two-way sharing arrangement, but it is just the patient who would take the decision about the extent of the sharing. In paragraph 7 of the reply, the administration said that the HCPs can gain benefit and should also make contribution. Now we have to be clear that the system is for the benefit of the patients themselves, not the HCPs. The HCP's convenience should come after the interests of the patients. I have to point out also that the HCPs can get access to the record, but there is no obligation for them to upload the data to the government record. As to whether they choose to upload the information to the government system, it will depend on whether they are willing to do so, or whether they have the facilities to do so under the law. There is no obligation to upload the information. Even if they are part of the EHR system as a registered HCP, he can view the information, but it doesn't mean that he has to upload the information onto the government EHR system. I don't propose to argue with the administration anymore here, except to say that I hope members will consider my proposal and see whether these are more in line with the interests of the patients. I leave the technical aspects to the administration. According to the reply, they in principle object to my CSA because the concept is it is conceptually different. I hope members will consider whether in principle they are prepared to support my CSA. The technical matters would be a secondary consideration. 16AB, the administration seem to be saying that the provisions that will cater for any kind of changes is a matter of whether they are going to do it in future. I wouldn't assume that they're going to do it or they're not going to do it. But if they're going to do it under 16A and B, there should be further amendment, because under the proposed 16A and B, even if you're going to do it, you have to specify that even if the sharing restrictions are in contravention or in conflict with other provisions, then you should say that notwithstanding other provisions, this ordinance, blah, blah, blah. Let's say in clause 12, there is a definition for sharing agreement, but this is bundled with the joining consent. But in 16A, there is no mention of splitting the joining consent and the sharing consent. So to remove the misunderstanding, some data can or should be bundled together for uploading and downloading. If you want to deal with the scenarios under 16A and B, and if this is technically feasible, and if my proposals can be covered, then under 16A and B, you have to specify that notwithstanding provisions in other parts of the legislation, 16A and B would be overriding. These sharing restrictions will be overriding. And that will meet my requirements, because otherwise you will have everything bundled together. I don't really want to get involved into any argument with the administration. I just hope that members will contemplate ponder my proposal and see which one would be more respectful of the patient's choices while keeping a two-way sharing arrangement. Mr. Chen, will you deal with Dr. Leung's proposal first before we move on to something else? Mr. Chen. I'd like to say, Mr. Chairman, that Dr. Leung's proposal represent a totally different approach to what we have in the bill. In our design, we anticipate our idea is first of all whether the patient would be prepared to join, and that is the joining consent. Once he has given the joining consent, then he will give the sharing consent to the HCPs. Now the consent would include two things. The HCP can view the record as well as uploading the record. So our design would be in line with the voluntary participation spirit and also on the two-way sharing arrangement.
We explained in the past that in actual operation, in private clinics and private hospitals, they need a certain process to computerize things. So on day one, they won't be able to share all 9 pieces of information that we ask for. They may only work on 2-3 items. But then for us, we want to make sure that all private hospitals and clinics can upload the information, but it will take a process. The final goal is for the organizations to be able to read and retrieve information. Based on Dr. Leung's suggestion, I'm not saying that there are unsatisfactory elements, but then after the designed system is up and running, at the beginning, some organizations may only have the consent to upload or to read. In some cases, some organizations can only read, but they won't put in information, and vice versa. So at the beginning, let's say if the design is such that some people will only unilaterally read and retrieve information, then that is in line with our idea. So that's why we said that we are against this suggestion. And then technically speaking, it seems that we have to redo the whole system. The things that we have already done will be useless. So first of all, this is incompatible with our policy rationale. In some special cases, some people want organizations to only be able to read and put in limited information. We said that 16A and B suffice because they do not dictate on the way of restriction. You can make use of different kinds of restrictions. For example, at a certain point in time, some organizations' right to retrieve information and to upload information will be restricted. But it depends on whether the organizations and stakeholders agree to this approach. Now, do we need to add notwithstanding in order to play safe? When we drafted the document with the biggest flexibility, we have thought of this kind of phrase. Perhaps our drafting division can explain why this phrase is not necessary. Ms. Choi? Thank you, Chairman. Thank you. Now, 13A deals with health information, and the focus is on the health information. The scope of sharing will also be restricted. And this has to do with the targets, the time, a certain occasion, the type of information. And when it comes to the sharing consent, That means people can retrieve and provide relevant information for sharing. So what is information for sharing? If there are restrictions, then information that can be read will be restricted. So I don't think that there will be a conflict. There is still the consent, but then people won't be able to read anything. Do you understand? Please don't ask me whether I understand. Chairman, do you understand? Ms. Choi, can you explain further? Perhaps they don't quite understand. Okay, in 12.6, the consent is to say that the patients can provide information for sharing. So what information is information for sharing? If there are the restrictions, then in other words, those information will not be information for sharing. And then in 2, the methods include two-way and one-way. Information can be uploaded, and in retrieving information there can also be restrictions. So what will be information for sharing in 16A? If there are the restrictions, then, well, there will be already the necessary restrictions. 6A, bracket Roman number 1, already allows the commissioner. Let's say if under 16A, the commissioner decides to put in place some restrictions, not the commissioner, it's the service receivers. If they put in place some restrictions, then the commissioner will act accordingly. Then in the system, some parts will be overridden, and then the information will not go to the health providers. So 12 and 12A are not inconsistent. Because of clause 12, 6, it won't be the case that 12A cannot stand. The two deal with separate things, so there shouldn't be problems. Mr. Chen, okay, I'm not an expert, so let me explain in layman terms that will help members to understand. Dr. Leung is worried that, okay, with 16A, so many things can be done. Then will 16A be in conflict with number 12? We have discussed with our lawyers. 16A contains restrictions that can take many forms, because now we have allowed a lot of flexibility in our drafting. And clause 12 refers to the sharing consent, and that includes allowing people to read and to upload information. So in 16A, if we put in place some restrictions, so eventually when users and readers read information, if the information will be less, then it still is not in conflict with clause 12. So we don't need to add notwithstanding. Dr. Leung? Do you need some time to digest this? No? I think I understand it. Perhaps let me put it in another way. Ms. Quad also asked a similar question. In some other parts, perhaps there are some very rigid elements so that 16A cannot accomplish its goal. Ms. Quad said if you have written certain points in a very rigid way, now the healthcare providers will be based on organizations, then how are you going to deal with individual doctors and departments? The government said this is workable. How come? Because this is written rigidly in the law. And in 12, sharing consent means 12.6A1, 12.6A1, and 12.6A2 refer to provide information and retrieve information. So that's about the sharing consent. So my last suggestion is, even if you add notwithstanding, what is the drawback? I'm asking you to add notwithstanding. That will make things clearer. What is the bad point of doing that? Okay. Now, we're about to adjourn the meeting. There are not many members present. Dr. Leung has made some counter proposals. I think the government can consider. If we have to decide right away whether the committee will support the CSA, well, we don't have a quorum now, so we cannot make this decision hastily. And Dr. Leung, you want this committee to move this amendment, right? Yes, this point should be recorded. And I have heard some of your other suggestions. If the government is willing to add something to other provisions, if the government is willing to give way, then you will also be willing to consider. On the 1st of June, we will have another meeting. I won't be in Hong Kong on the 1st of June. Oh, we won't have time to change the date. Okay. Perhaps the administration, the government can go back to reconsider. If Dr. Leung's concerns are late, then perhaps he won't move the amendment. Otherwise, before the next meeting, we will confirm with you what your position is, and then we will have to make a decision as to whether or not this decision should be made by the committee or by me as chairman of the committee. If we are not going to do that, then you can move the CSA yourself. We won't be able to make this decision today. Perhaps the government can do something more to convince Dr. Leung. Okay, if you do not object, then we should arrange accordingly. The next meeting will be the last one. If we still want patients to be able to enjoy the system, if we don't want to see further delay for a few more months, then we have to deal with all the outstanding issues in the next meeting. The government will present their CSAs. I think we have examined them already, but then in the last meeting we still have to go through them. The next meeting will be at 2 to 4 on the 1st of June. 2 to 4, yes, this is quite an odd time. I think it is because of availability of meeting room. So we have to meet a bit earlier. Please come back earlier after lunch so that we have a quorum for the meeting. Chairman, that will be the last meeting. So when do you plan to resume second reading debate, Mr. Chen or Secretary? Okay. Based on my understanding, on the 19th of June during the HC meeting, if this committee's report is endorsed, then on the 8th of July, we'll be able to resume second reading debate and third reading. That will be the last chance before the summer recess. Okay, so please do it as soon as possible. Why are we going to HC so late? We will complete our work on the 1st of June, yes. But we will go to HC on the 18th. Do you have earlier time slots? On 19th? On the 5th of June? Okay, if we can complete everything on the 1st of June, you can go to HC on the 5th. Why don't Why do you want to wait till the 19th? I'm not sure about your HC meeting timetable. Chairman, if you can complete discussion on the 1st of June, then you will present an oral report. Yes, you can do it on the 5th. Then we will be happier, because we don't want to delay. We don't want the system to be deferred for another half a year. Yes, please be quick. We can give oral notice on the 5th. So please check the earliest date of resumption of second reading debate. And please try to convince Dr. Leung as well. No matter whether they can convince Dr. Leung, I think we still have to resume second reading debate. We're not going to dump the bill anyway. Okay, so 1st of June, we will meet again. If there is no other question, we will adjourn here. Thank you.